Okay, I think we are live. Welcome, everyone. This is Catholic Healthcare and Artificial Intelligence, a Health Progress AI Week event here on LinkedIn Live. We're happy to be with you. I'm Brian Reardon. I'll serve as the facilitator for this LinkedIn Live event. I'm with the Catholic Health Association. I'm going to introduce the two presenters today. First, we've got Dr. Daniel Daly. He is the founding executive director of the Center for Theology and Ethics in Catholic Health, and he's also an associate professor of moral theology at Boston College. In March, he held a conference on AI ethics in Catholic healthcare at Boston College. And last week, he was a panelist at a congressional briefing on the Pope's new encyclical at the US Capitol. So, Dan, welcome.
Thank you, Brian.
And next, I'd like to introduce Kathy Curran. She is Senior Director of Public Policy at the Catholic Health Association, and she has degrees in law and Catholic clinical ethics. She manages CHA's regulatory advocacy and leads our policy work on health equity and artificial intelligence. She also serves on the Center for Theology and Ethics in Catholic Health Advisory Board. Kathy, thanks for being with us.
Great to be here. Thank you.
All right, and for those watching, if you've got questions for Dan or Kathy, just put them in the comments section. Those will get passed along and I can ask those. But I think we'll start off, Dan, probably a logical place to begin is with the Pope's encyclical. You've spent a lot of time looking at Magnificat Humanitas, safeguarding the human person in the time of artificial intelligence. It's humanity, or magnificent humanity is probably the English translation of that. So you had a chance to read it, to digest it. Maybe we can start there, Dan, and just kind of what are your biggest takeaways from that encyclical?
Well, thanks, Brian. As the name suggests, it is about humanity, first and foremost. It's, ostensibly the occasion is this kind of AI revolution that we're currently undergoing. But it's really about who we are and how we ought to use this tool to promote human flourishing. And so it raises up the magnificence of humanity, whereas others are really touting the miraculous nature of AI. The Pope is doing something a little different here. And what he does is, there's a number of themes I think we want to get on the table. The first is he rejects what's called the technocratic paradigm. That's the idea that all problems are technological problems and all solutions are technological solutions. So the idea there is basically that as long as we get good enough technology, we can solve all of our problems. And he believes that's not the case. Our problems are more moral than they are technological. And there are technological problems, and we should leverage technology to solve those problems. But we have massive moral problems, as we see, and he goes through in the document. So he really wants to open up a kind of a notion of human flourishing, that we flourish in relationship with God, with others, through our work, through our leisure, and even in and through our suffering, which is counterintuitive, but I think, we may have a moment to unpack that. So he ends up rejecting transhumanism and posthumanism, the idea that AI will change us into some kind of a different being, a being without any limitations. He rejects that. He also rejects this kind of hyper focus on efficiency and optimization. Some people are, talking about maxing in our lives. He rejects that perspective. That's not the good life that Jesus invites us to. That's not the life of abundance that we hear about in John 10:10. I would say a couple of other things briefly. He invites us to a shared participatory discernment process. We need a robust public discourse, much like we're doing here on LinkedIn Live at this moment, so that the public can become the protagonists in this conversation, not its victims. That the technocrats don't make decisions for us, we make them for ourselves. And he really ends up analyzing, and this is a place that I'd like to go deeper if we can during the conversation. He analyzes AI in light of the preferential option for the poor. He rejects the techno-optimist dogma that AI will produce a rising tide that lifts all boats. He just doesn't think that's the case. And so a test that he proposes in the document essentially is, what will AI do to and for those who suffer in the world? And I think that's a really important point. And very briefly, the final point I'd make is he really holds up work as an essential aspect of our flourishing. Like a world without work, which some AI utopians, these techno utopians are proposing, that's not a utopia, it's a nightmare. We develop through our work, we support our families through our work. We become ourselves in many ways through the work that we do. And so a world without work is not something that we ought to aspire to.
All right, thanks, Dan. And as a reminder to those watching, if you have questions for either Dan or Kathy, just put them in the comments and we'll get those as they come in. But I do have another question related to the encyclical, really for both of you, because you were both attending last week's congressional briefing. Members of Congress actually were interested in getting the Catholic Church's perspective on here in the U.S. on the Pope's encyclical. So maybe Kathy, start with you, and Dan, you can chime in since you were presenting along with the Conference of Bishops and others about what were some of the questions, what was the dialogue with members of congressional staff on the encyclical as it relates to potential public policy.
Yeah, thanks, Brian. I have to point out or start by saying we had an amazing turnout for this briefing. These kinds of briefings happen all the time. And I was really impressed by the number of staff. I think we had close to 100 staff in the room. And also I was impressed by the robust questioning, and people are grappling, Hill staffers like all of us are grappling with issues of how to determine what are the right ethical standards and the right legal standards, and what's the starting point, and how do you implement reasonable regulation that is necessary for safety but doesn't unnecessarily hinder innovation. So there's a lot of activity on the Hill right now. Many bills have been dropped by many different congressmen and congresswomen and senators, and there's an effort right now to get something passed on kids. So there's a lot of interest on the Hill right now. I was very pleased by the turnout, and I think people are hungry for some direction, and that's where the encyclical really steps in, where the Holy Father can set forward, from a Catholic perspective, as Dan was just explaining, how we should approach AI and how we can use it as a tool for humanity to improve humanity, not to try to replace humanity. Dan, do you want to add any other thoughts from last week?
Yeah. So, I mean, it was, as you said, Kathy, it was an incredible turnout and really robust questions. And there were kind of three questions that stood out, or a couple of questions, and then a general mood in the room. The first, I spoke about work and war, because the document, it drills into those specific issues. It actually doesn't do much on healthcare specifically. There's kind of ancillary oblique references, but not really directly on healthcare. But there's a lot on work and war. And so, we got a question about war. What if, Leo is calling for diplomacy and even forgiveness as we deal with war, and he's inviting the international community to come to an agreement on the use of AI in warfare. He sees that essentially the use of AI in lethal weapon systems AI should not be used to kill. It should always be a decision that's made by a human being. So one of the questions was, what if our adversaries don't agree to these international rules? What if we set up these rules and they don't agree, and then we're at a competitive disadvantage? So we tried to work through that a little bit. There's no easy answer there. Another question was, where's the line between this document gets into, as I noted earlier, transhumanism and posthumanism. And again, the idea is that we would somehow combine with AI through things like brain interfaces to upload our consciousness even into the cloud, into the web, to really expand our intellectual capacities and even live a deathless existence, that we could be uploaded and then therefore never die, is the promise of some of these posthumanists. Now, the question is, but there are also really good therapeutic uses of AI for things like persons with deafness or blindness. Can we use AI? Can we leverage AI to help to address those problems? The question that was raised is, what is the line between therapy, which we support and the Pope supports, and enhancements, which the Pope, generally speaking, is much more skeptical on enhancements. And so it's a great question. And that's, my answer to that was, that's a decision that we make. The analogy that I drew was in athletics that, there's the use of protein powders like creatine, which if taken and used, and people exercise when using those, can build a lot of muscle. And we think that's perfectly fine. You can compete in the Olympics while using creatine, but not steroids. We drew a line between these two chemicals to say one is fair to use and one is unfair. We're going to have to do the same thing when it comes to therapy and enhancement. There is no easy answer. Finally, the room, not unsurprisingly, was very interested in the policy implications of the document. And so that gives me a lot of hope, is that these folks who are helping to craft policy are considering what an application of Magnificat Humanitas would be into U.S. policy.
Mhm.
And so there again, there was a lot of energy in the room around that. And as someone who's not a policy expert here, I defer to my colleague, Kathy. We had a good discussion, but I think there's a lot of work that needs to be done. But there's a lot of hope that people who are setting policy are taking this more seriously.
Yeah, and kind of playing off the sports analogy, Dan, I think the policy question comes down to who's calling the balls and strikes on this. So you use the example of, enhancing chemicals for sports performance. In healthcare, again, we're using AI. I think anybody who's been to their physician office sees, the basic use of ambient listening, but then there's all these other applications, which we'll talk about in a minute. But who gets to decide what is morally right and what is crossing the line? And did that come up at all in the hearing?
Yeah. I mean, I think it's a question of who should decide, and I think that the clear answer from Pope Leo's perspective is we, the public, should decide. It shouldn't be the technocrats. And ultimately, I think one of the tests, and I mentioned this earlier, is what does it do to those who suffer in the world? How does it affect the common good?
Mhm.
The problem with the use of steroids is it creates two classes of athletes, right? You cannot compete with someone who's on steroids if you're the same talent level and you have the same work ethic. You simply can't compete. They have an unnatural advantage. That's an inequality that tears apart the realm of athletics. The same thing can happen just in our general society. If we have an enhanced class and those who aren't enhanced, the inequalities are so great, there's no real communion or even competition between those folks. It's a fundamental unfair advantage. And this is where Leo is very strong, and he says, if we don't do something, AI will be leveraged for those who have power and wealth. And it's a stark warning, and I think it may be the strongest warning that he gives us in the document. I invite folks to read paragraph 161, where he goes through that.
Kathy, anything to add on that?
I mean, I think as the encyclical points out, if we're trying to decide where sort of moral lines are from a policy perspective or in any other context, you need to start with the principle of the dignity of the human person and the common good. So, as just aligns with what Dan was saying, any particular application or use of AI, we need to ask, the developers need to ask, society needs to ask, who is this helping? Is it going to be upholding and supporting the dignity of the human person in all the different ways that it's used? Is it going to serve the common good of our society? Or as Dan said, is it going to just represent a collection of power into the hands of the few? So, in terms of the policy perspective, I think, our job, the encyclical, and then our job as Catholic Healthcare is to bring some of those moral standards and concepts to the policymakers and help them as they grapple with the details of policy formulation. And it's in terms of policy where the line is how much regulation or how much to have or not to have. That's a difficult question. It's a call, and it's something that obviously is a political issue outside of AI as well. What role government should play in regulating all sorts of things in society. But I think it's a particular challenge here because AI is developing so rapidly, it's already so integrated into people's lives in ways they don't even understand. And there's this huge accumulation of knowledge and wealth and power in just a few hands. So, trying to work that out in the context of today's political atmosphere is a challenge, but there's a lot of really good people on the Hill trying to do just that.
I do want to go to a question that was in the comments. Somebody asked, how should Catholic health hospitals approach AI for the good of the patients? So either one of you want to take that one?
Yeah, I'm happy to hop in. I think, certainly we've already seen how AI has benefited patients in many ways. Like radiology, this is 15 years old in radiology, discovering pathologies that the human eye just hasn't been able to discover, right? So I mean, it's already been leveraged for some real good. The problem is that it's very uneven. It's not entirely trustworthy, and I know we'll probably get to talk about this a little later. It can be very biased. So it really, and this is something that Antigua at Nova warned about, that in healthcare, the benefits that will accrue to people through AI in healthcare seemingly will accrue to those who are very well connected to the internet, have wearable devices, have an electronic health record, and are part of a dominant group, whiter, wealthier, educated, Western, you name the groups that are more dominant in our world today. And so we have to be very careful to ensure that everyone benefits from it.
Mm-hmm.
And that the benefits really are, it's not just, the human person isn't just a thing. We're not material. We're whole persons. And, that AI doesn't reduce us to data. It doesn't reduce us to something that we're not, that we are whole persons. And in fact, the most important aspects of us are not our data, but rather our relationships with God, with others. And I think that's key, is that Catholic healthcare has this perspective, this holistic perspective. And in leveraging AI, it has to continue to view AI through that holistic perspective.
Yeah, I totally agree. And I think one other thing that Catholic hospitals need to do when they're analyzing and deciding which AI applications to use, whether it's clinical or administrative, is making sure the human person is always in the loop, is the phrase, the human in the loop. So whether it's using administrative AI to make decisions about payment or reimbursement, or using even in the radiology context, where, as Dan pointed out, it's been used for close to 15, 20 years now, and it's pretty much ubiquitous in radiology. But you always need to have the human doctor there to check what the AI has decided. And certainly in clinical applications and surgical applications, you always want to have the human physician present and exercising his or her judgment. And I'd say the other thing hospitals and systems can do, and what many of them are doing, is really set up robust internal oversight and control of what's happening. So bring together your colleagues in clinical, administrative, governance, your data and IT people, and systems are forming committees that meet weekly or more often to consider new use cases, to review how particular AI tools are being used and received. So that organizational from an organizational ethics perspective, hospitals need to really be intentional on how they analyze and use and adopt and continue to review AI, because don't forget, it's not like you buy a tool and you're done. AI tools are continually learning. So you need to continually monitor whether the outcomes are good for the patients.
Yeah, and Kathy, I want to follow up a point you raised in your article. I'm going to do a quick plug for Health Progress. The new issue is online. We'll put that in the comments section, but the whole issue is dedicated to the issue of AI, in particular Catholic healthcare. And Kathy, you had an article, and I love the question you raised in your article about when something goes wrong with AI. Mm-hmm. Does the responsibility lie with the clinicians or the hospital that use the AI tool, or with the company that developed the AI tool? So what are you hearing from different folks about that issue of what kind of safeguards or planning can be put in place to figure out where does the responsibility lie when, Dan, you mentioned this earlier, it's not a perfect tool. there's probably going to be more and more over-reliance on it, and things are inevitably going to go wrong. So how do people prepare for that? And what are you hearing, Kathy?
Yeah, well, one of the challenges with AI tools is the hospital or physician using it doesn't know how it was created, how it was taught, the data that it was built upon. So there's not always a whole lot of transparency around how this tool was created, but still we're using these tools. There hasn't really been any legislation, to directly address the issue of AI liability in the healthcare context. And really, it's so far going to be dealt with under traditional tort law concepts of negligence, product liability, and medical malpractice. And very few of those cases end up in written judicial decisions. So it's a little bit hard to track where it's going. But the traditional structure is there a duty to care either between the physician and the patient or between the producer of the device? Was that duty breached? Did the breach cause harm? And then what's the what kind of compensation should there be for the harm? And if you've been following what's been going on in Washington over this legislation, a package of legislation to different bills to protect kids in different ways in the AI space. There's a big debate over whether the bill should have a duty of care clause or not. And that's getting to this issue of liability. Should there be a legal and statutory imposition of a duty of care on developers to make sure that, these tools aren't used in really harmful ways by kids? So right now, that's kind of the state of the situation of liability with respect to healthcare and use of AI.
All right, thanks. Dan, I want to move to the conference you hosted at Boston College in March. I was able to attend and just really rich dialogue on this topic. But one of the things that jumped out at me during the discussions over that day and a half was obviously the Catholic Church and the Vatican have been working on this issue for a long time, and there's actually some norms that have been established. I think there are 7 ethical norms that were highlighted. Can you share a little bit about those? Maybe you don't have to enumerate them all, but what are some ones that jump out to you that our audience might be interested in hearing a little bit more about?
Yeah, thanks, Brian. Yeah, so at the conference, presented 7 core norms in a statement that we put out, and we actually had over 50 participants of the conference endorse that statement, including these norms. And so these norms, they really have been emerging over the past few years, both within the Catholic healthcare community, but also in the Vatican documents that have come out on this. There's a lot of convergence on these. There's a lot of agreement within the Catholic community in healthcare on these. I'd say a core one is that AI must enhance, not erode, the quality of the patient and professional. That relationship is sacrosanct and should not be undermined by the use of AI. One that I think doesn't get enough attention is that AI should expand access to care, especially for those who lack it. The conversation on AI is at kind of top level, new technologies, cutting edge. We still have massive problems in healthcare. None is bigger than the lack of access that so many people suffer with. And AI has to be leveraged from the Catholic perspective to expand access. I would go along with what Kathy just said. Human decision-making must remain the norm. Human beings must be making decisions. The AI is a tool to help that happen, to augment that, but is not to replace that. And I'd say the last one I'll highlight here is just, I've talked a little bit about work, but AI should promote the well-being of healthcare professionals, administrators, and staff, respecting the dignity of their work. Now, the workforce is going to change. It's changing. It's never static. There is never a moment we can point back to and say, well, that's the healthcare workforce. It changes every year, every, few years. But as AI does transform the healthcare workforce, the dignity of the work that's being done, the importance of the relationships that professionals and patients have, that has to be respected. And we can never do away with human caregivers in Catholic healthcare. I would say in healthcare in general, you don't have to be Catholic to believe that healthcare is a healing art and that healing happens between persons. And that we should use all of these technological tools insofar as they can help human beings heal each other.
Yeah, well stated. Just as a reminder to those listening on LinkedIn, if you have any questions for Dan or Kathy, just type them into the comments and I'll pass those along to them. We'll do one follow-up question. Dan, you just mentioned, the caregivers and obviously the role that they play in that human connection. I think the other issue that I remember that came up at your conference was about de-skilling, that we rely more and more, and I think we can all relate to this in our own lives of how AI just around us, and whether it's in our smartphones or whatever, it's in some ways making our lives easier, but it's also, taking away. I use the example of, you're typing a text and it's going to fill in stuff, and sometimes you don't want it to do that, but it's also, it may be diminishing our ability to string together a coherent sentence because the computer is kind of doing it for us. So what are some of the takeaways around de-skilling of clinicians as AI becomes more prevalent in delivering care?
I would say that in general, and theoretically, there's no problem with de-skilling in a sense, right? So I don't know how many people on this call can read a compass. If you have children, how many of your children can read a map? We can all read, if you're an adult, you can read a map, but the children might not be able to read a paper map because of phones and the way that they kind of give directions, right? So there's some de-skilling that happens. It's fine. I don't lament the fact that I can't use a compass to navigate the world. But there are certain skills that we cannot lose. So there are intellectual habits in terms of making judgments, understanding information, understanding other people. We cannot outsource that to an AI. First of all, I don't think AI can do that well. AI is reductionistic. AI sees the world as data. I don't know any human being who makes decisions purely based on data. And that's what AI does. There are things that you and I know that can't be put into data. And so, and especially in healthcare, when you're caring for patients, when what you're after is both treating the patient's disease and helping them to be cured if possible, but ultimately healing, to be with patients, to accompany patients, which is an enormous emphasis, as we know, in Catholic healthcare. We cannot be de-skilled away from that, from the ability to walk with patients and accompany them. If AI can free us to do more of that, then I'll celebrate it as an enormous victory. But there are certain skills, and I leave this to a conversation within the medical community. What are those essential skills? What are we willing to be de-skilled from, such as reading a compass? There are things in medicine that it's okay that we're de-skilled from, but there are certain other practices that we should never be de-skilled from.
Just to add something to that. So I know medical schools and nursing schools are grappling with this now, how to make sure that they're using AI as a tool to help their students learn the skills. So this isn't de-skilling, this is acquiring the skills in the first place. Are they using AI in a way that is an appropriate tool for the students, or are the students relying on it too much? And so trying to get that right balance is important as you're training future doctors and nurses.
Thanks, Kathy. I'm going to go to a question that was in the comments, and the question was, are there any best practices for avoiding machine bias that maybe you've heard about or could reflect on?
So, yeah, I think, in terms of best practices, I think the first one is vigilance. And in fact, the Pope invites us to be vigilant. We need to be critical that the issue is that these AI models are being trained on data that is biased. We know this. There's a phenomenal book that I would recommend folks read that's The AI Mirror by Shannon Valor. And the argument essentially is this: AI is a mirror of us. It is not more objective than us. It is not better than us morally. It is us. Why? Because what we feed it data that we have generated. So I'll give you an example from the healthcare space. In healthcare, a lot of these tools are being trained on electronic health records. Now, who has an electronic health record? Well, people who have insurance, so people who have jobs, and it skews demographically towards some communities and away from others. So there are some communities who are underrepresented in the data, whose lived experience, whose health conditions, whose even genetic, background, diseases that are based in, their ethnicity, they are not as represented. So the data is inherently biased because we have been and we continue to be biased. So there needs to be an enormous amount of work done to overcome that. And I think a best practice is one, vigilance, not being overly trusting of the AI outputs, because there's an adage, garbage in, garbage out. If you're putting in limited data, you're going to get back a limited result. And that happens in every single AI search or every application. It is not perfect. And I'd say the second best practice is to make sure that our data sets are representative of all people. And that's going to take an enormous amount of work, because the way that it's been done so far is we've just been leveraging the data we've collected. We haven't been collecting this data for the purposes of AI at all. It's just there and it's being leveraged for AI. Now we're going to have to be much more intentional about the data that we use, the data that we generate, and the data that we use to feed these tools. So I would say vigilance and, a much greater focus on data and what data we're using to train these models.
Yeah, and I think another issue is the algorithms. So the data comes in, but then what are we telling the machines to do with the data? So, and how are we developing those algorithms? The famous example everybody always uses is where they attempted to identify patients who they should reach out to as needing additional care. And they use as a proxy for that healthcare spending, on the theory that the more healthcare you've gotten, the more money you've spent, the sicker you probably are. But they found out that they were getting disproportionately white patients recommended for additional care. And when they dug into it, of course, they realized that there was an underlying disparity in the usage of healthcare from a spending perspective, because certain populations can afford healthcare more than others or less than others. Certain populations are less likely to go in for care. So when they figured that out and they redid the algorithm, then they were able to capture, African American and Hispanic people who should have been offered additional care because they were among the sickest, but had been not picked up by the algorithm. So, and I think we need to be like people. I want to say about the word bias. Sometimes people think that means, oh, people were intentionally biased in what they did. And that might happen, but that's not what we're talking about. What we're talking about is having real intentionality in understanding the population you're trying to serve, the data that you're gathering, and the algorithms that you're creating to manipulate that data, and having some deep humility about the fact that we don't know what we don't know. So, I think this also underscores the importance of having teams to evaluate this, because you need people from different perspectives who can ask different questions about the data and about the algorithm to make sure that it's really meeting the needs of all the populations you're trying to serve.
All right, thanks. We've got a couple more questions that were in the comments. I want to jump ahead to one that I think is really interesting. And bear with me, it's a longer question, but I think it's one that definitely want you both to reflect on. The question is, if a health system has a responsibility to follow tens of thousands of patients, let's say, at home, and AI tools can bridge the contact with those patients and escalate to human caregivers, does reaching out via artificial intelligence create a duty to care versus not reaching out at all? That's the first question. The second part of the question is, if the quality of care improves for groups outside the walls of hospitals, which is better if there are simply not enough humans to make initial contact? So again, that sort of duty to care one, maybe one of you want to take the first part of that question?
Well, there's a lot of issues embedded in that question. And so, my lawyer brain focuses on the duty of care. So if you're talking about like creating a duty of care for legal litigation purposes, I can't directly answer that question, but I'm assuming that the duty is created between the patient and the doctor in the first place. So the use of the AI as a tool is probably not itself going to create a duty of care, because you already had a responsibility to follow these tens of thousands of people. I think it also, raises an important point about AI, which it is an important tool to be able to reach people who otherwise wouldn't have access to care, because we have shortages of human providers. So it's a balance between, using AI to reach people who would otherwise not be able to get healthcare, but finding a way to make sure that there's always a human person somewhere in that link. I don't know, Dan, do you want to add anything?
Yeah, and I would just, I'm kind of, as an ethicist, focused on the word duty. I mean, certainly I think, duties are very important. You you should never be negligent in fulfilling a duty, but duties aren't the only thing that motivates us in the moral life, or at least they shouldn't be. Just because we don't have a duty to patients doesn't mean we shouldn't do something for them. I think to reduce all of the moral life to the fulfillment of duties that's a thin moral life. And even for health systems, we need to go beyond duty. What does it mean to live in the healing ministry of Jesus Christ as we use these tools? Jesus invited us to always fulfill our duties, but never be satisfied with simply fulfilling our duties, to go beyond. And that's what Jesus does with his healings. He's not obligated to do this, but he goes around and he is constantly surrounded by people who are seeking out his healing. And I think, we are surrounded by people who are seeking out our healing in Catholic healthcare and in healthcare. How do we, even if it's not an obligation, how do we begin to try to heal those people or bring healing to them? How do we use AI? And I think this is going to be the ultimate test for AI. Does it help us to expand healing and care to those who have been left out of the system? And that's a part of this conversation that you do not hear in the public sphere in a way that Pope Leo is satisfied with. It's clear in his writings, and you see this in all of the writings that have come out of the Vatican, Antiqua et Nova, and now Magnificat Humanitas. This preferential option for the poor must be one of the central tests of AI.
I think this question is at sort of a high level, is asking if a hospital has available a tool, an AI tool that can help it to serve its patient base better, does it have an obligation to use that tool? And I think the question is, I suppose the short answer could be yes, but I think it's a more complicated question. That's why you need to have, really good organizational, ethical structures and clinical decision-making structures around this, because you would have to analyze the benefit of the tool, the cost of the tool, the ease of using it. But I will say that just from talking to our members, many of our members are already doing this. They are already using AI tools that help them to manage the health of populations within their community outside the walls of their hospital. But the question whether when a new tool or device or procedure, whatever it is, comes on the market and is available and can help you provide healthcare in a better way, what is the obligation to use it? And I think that question applies not just with AI, but with all kinds of procedures. And that's what internal governance should be asking the questions and answering those questions.
Great, thanks. Yeah, again, a very good question. Another question that came in the comments, and again, as we kind of get in the home stretch here over the next 10 minutes, if anybody has a comment, would encourage you to put it in the comments now so we can get to it before we wrap up. I don't know if we can answer this one because, again, our association really works with acute care hospitals, but somebody had asked about dentistry, and I don't know if either of you have heard or anything about AI supporting dentistry as part of the broader healthcare system. Any comments on that? That may be one that's a little bit out of our wheelhouse, but did want to acknowledge the question.
Yeah, I can't say we follow oral health and dental care issues from a policy perspective. And, generally those kinds of procedures aren't covered by mainstream, typical health insurance plans. So we're talking about different databases for different uses. Having said that, it would surprise me if there was not, AI uses in dentistry. And we have focused mainly on acute care today, and I guess physician practices, but they're using AI in lots of different ways in long-term care to provide palliative care services. So I do know that AI is being used across lots of different kinds of healthcare contexts and practices. So that's all I can say about dentistry.
Yeah, and I can't speak specifically to dentistry, but what I do know is that the AI is being used mostly in healthcare on the administrative side. It's not the clinical side at all. The clinical side is lagging behind, like way behind. Healthcare is, in fact, one of the slowest industries to integrate AI. And there's a lot of reasons for that, and they're all good. I think it's actually, there are good reasons. Healthcare is actually, in many ways, following Pope Leo's invitation to be slow. And I wouldn't be surprised if dentistry is being slow about this as well, knowing nothing about it. But certainly there's administrative efficiencies that you can create by using AI that are not entirely without moral controversy, but less controversial than, let's say, the patient-facing clinical ones.
Just saw another good question come in over comments, and it really speaks to the no mission, no margin question. And it was basically saying, AI very much profit motivated. And I do want to get into sort of the data center debate before we wrap up, and the environmental impact is probably one of the last questions. But the question was basically, how do you reconcile this notion that AI is being used for efficiency and for profit at the end of the day? How do we reconcile with that in our work as not-for-profit care providers with a preferential treatment for the poor?
Well, it's an interesting question, and it's an important question to be asking. I think, if you look at all kinds of medical equipment that is used in a hospital, those companies that are producing it are largely for-profit companies. So it's not unusual, I think, that the production of the AI tool is used it happens in the context of a for-profit production system. When our systems are using it, hopefully they're using it they may be well be using it to in administrative capacities to monitor what's happening. I know they're using it to monitor to respond to denials of care from insurance companies and other entities. So I think Catholic Healthcare, with respect to AI, has the same responsibility it has with all aspects of its operation to make sure that it is being used to serve the mission of Catholic Healthcare, and not simply as a profit center or as a reason, as a way to make money. So that's what I would say.
Yeah, Brian, I would say there's nothing wrong with creating profit and margin. I mean, that we need, as the adage goes, right? And efficiency, we should want to work efficiently. There's nothing wrong with efficiency on its face. The problem is, and this is what Leo identifies, is that it's the reduction of all goods to profit and efficiency, as if the only thing that matters is efficiently generating profit. Now, these are means to other ends. The end is the good of the human person. Healthcare is not like making widgets, right? Where like the product is a thing that you can identify. The product in healthcare isn't anything at all. It's the person cared for. The good is in the patient. The good is in the patient. And so we should want to have as much margin as we need to provide that good for the patient and be as efficient as we can be for the good of the patient. But healthcare, education, the rearing of children, some of the most important things we do, our faith life, are very inefficient. And if we attempt to optimize these parts of our lives, we will actually not promote the good itself, whether it's the child who's been raised well, the student who's educated, the patient who's cared for, cultivating a relationship with God. Optimization, efficiency, these can get in the way of promoting those goods. And sometimes you just need to sit with a patient and hold his or her hand. And believe that is not an efficient, optimized use of a nurse's time, but it's precisely what Catholic healthcare, and I would say all healthcare, is about.
As I think people know, the current Holy Father chose his name as sort of an homage to Pope Leo XIII. And Pope Leo XIII, with his encyclical Rerum Novarum, kind of began the formal body of Catholic social teaching. And one of the issues that the Holy Father Leo XIII was addressing was the Industrial Revolution, and all of these, the robber barons and these industrialists who were changing the nature of work and building massive piles of wealth. And how do you deal with that? And that's why the Holy Father signed this encyclical on the same date, the anniversary of Rerum Novarum, because that's what we're undergoing now, is an AI revolution, and dealing with some of the same issues that they were dealing with, 125 years ago. A few people with great ideas and leading wonderful innovation, but power and money being accumulated in very few centers. And how do we deal with that? And how do we work that out as a society? And that's where we are now. And that's what the Holy Father is trying to guide us through his encyclical.
All right, two more comments. Again, I'm going to skip ahead to one. One was on the environmental impact. I won't read the full question, but the folks watching can see the comment. I think that is something we did want to address. It's addressed in one of the articles in our issue of Health Progress. But what should we, particularly in Catholic healthcare, keep in mind about as we, again, adopt this technology? There's an environmental cost, and we've seen this pop up in the debate around data centers, particularly in rural areas. We're seeing speakers who mention AI getting booed at commencement speeches. So how do we rectify, or what should we be thinking about in Catholic healthcare about the environmental impact that this technology is having on our shared home?
Well, Brian, I think it's an incredibly important question. I think, again, one that is not getting enough attention in this whole conversation. AI could be leveraged to help us to use energy more efficiently. It could be leveraged to help us discover new ways of generating energy. And so we should recognize that, and I think it already is being leveraged in those directions. But we cannot help but understand just how resource intensive it is, whether it's use of carbon or water, where these data centers are, who's suffering under them, and the environmental effects of them. So I think it's I think we have to be cognizant of how we're using AI, because these searches, a single search is something like 4 or 5 times more energy intensive on AI than it is on a web browser. And so, that's a small application. When we think about these things in healthcare, there are massive applications and an enormous amount of energy. We don't want to undercut the goods we're trying to promote in public health in Catholic healthcare by, spewing out more carbon into the environment, polluting water, draining aquifers, all of these things. So you don't want to promote one good by undermining that good in its promotion. And I think that's why we have to be incredibly sensitive about the environmental impacts and prudent uses of AI, not frivolous uses.
Yeah, I think it's a difficult question for, how to, as Dan said, continue to reap the goods of this while balancing out the potential harms in many ways, including to the environment. And I want to talk about the building of the data centers in various communities. And we certainly have a history in this country of, building factories and unpleasant type things in communities of vulnerable people or people who have less power than others. And so I think we really do have an obligation to try to do this one right and figure out how are we going to, what are the right number of these facilities to build, where are they going to be? And I think this is where another concept from Catholic social teaching comes in, which is, did I get the right one? Subsidiarity. So, the local people need to be able to have a voice and make these decisions. I personally, speaking for myself, not CHA necessarily, I don't think there should be some kind of federal law necessarily saying where you can and can't build these, but people in states and localities need to have a voice, and they need to be able to figure out where and when to place these facilities in a way that protects people who are more vulnerable and maybe don't have a voice in the process. So.
Yeah, Kathy, it comes you putting on your policy hat again, the sort of state versus federal regulations. Do you think states are being more, I don't know if aggressive is the right word, but maybe being more engaged on this issue because of the sort of local pushback in some of these communities where these centers are going?
Well, absolutely. Just in general, states have been very active introducing and then passing legislation on AI. They're a little bit more nimble than the federal government, so they can move faster, and they've been regulating in this area for 5 to 10 years. Just in the first quarter of 2026, in about 43 states, there were 250 bills introduced in just the first 3 months of the year, with 7 laws passed. That's almost equal to everything that happened the whole entire of last year. And I'm just talking about bills that affect healthcare in some way. Some of them are narrow bills just about healthcare. Some are broad bills that have healthcare implications. So the states have been very active. Almost every state in the country has laws on the books that affect AI in some way, not necessarily always in healthcare. So states are definitely very active on this. And one of the things that the current administration, has called for is to have federal preemption of state laws. So declare that states are not allowed to pass laws in certain areas, only the federal government can. And to a certain extent, that makes some sense, right? If you're a hospital system with hospitals in multiple states, it's easier to have one set of rules to follow. On the other hand, the federal government really isn't acting. And so the states need to be acting. Someone needs to be acting in this area right now to figure out what are the appropriate kinds of regulations. And some states may be going too far and some states maybe not going far enough. But in the face of sort of federal inaction, you need to have the states doing something to protect patients and children and other people who interact with AI. So again, this is one of the difficulties that we're in the process of having to work out right now. What's that right balance between federal and state oversight, and how do we achieve it? How do we identify it, and how do we achieve it?
All right, I think I have one more. It was a comment made, not necessarily a question, but I think I'm going to put it in the form of a question because I think it's a good one to kind of end on. Unless somebody else jumps in with a comment here in the next couple of minutes, I think this will be our last question. And really it was about this, you mentioned, Dan, that maybe the clinical side of things is slower than the administrative side in adopting AI. And I think the question we all have in just our daily lives and just our business lives is how fast do you go and how much do you step back and really discern? And as this comment said, it's not slow, it's being pragmatic. So I think my final question to the two of you is, for those watching, and particularly those who work in healthcare, how slow and discerning should we be, or how fast should we adopt this? How do you balance those two out? Because you obviously want to be competitive, you want to do what's right for patients, but we also know there's these perils of being too quick in adopting AI and the unintended consequences, perhaps. So what advice would you give for those watching that are really thinking about, okay, how fast do I jump on the AI bandwagon, try to find all these AI solutions to things, versus taking a step back and saying, you know what, maybe I need to give this a little bit more time and see how things develop.
Yeah, no, I think the comment is spot on. I would still say healthcare is slower, if you're going to use the metaphor of quickness or speed, and it's certainly slower than other industries. But again, as I said, and as Leo I think has and Antiquit Nova affirms, there's a reason for that. You're talking about people's lives, right? The consequences here are enormous. There are no greater consequences, I would say, than in healthcare and in war, because you're dealing with the possibility of ending someone's life, and so I think it's about prudence. It's about, if you think about vigilance, is what a lot of these documents will talk about. Yeah, caution. I mean, Aquinas writes about caution. You need to be cautious with things that can harm human beings. And so if it's on the administrative side, you can maybe move a little bit more quickly. The clinical side there's a line between the two. It's not always bright. The clinical and administrative bleed into each other in many ways. So I'm not going to say that that it's an easy distinction to make, but I would say that when you are dealing with patient-facing, especially these technologies, we have to be incredibly careful to make sure that the technologies are trustworthy, effective, and don't harm the goods that we care so deeply about, whether it's the patient-professional relationship, holistic care, all these things. You can't datafy these, right? You can't quantify these. These are transcendent values, and they require, in your language, Brian, discernment. And that's when a group gets together and in Catholic healthcare especially, prayerfully deliberates about the technology, its effects. It requires a significant amount of collaborative discernment.
So our current system already has some speed bumps built into it. Generally speaking, AI devices for clinical application are going to be considered medical devices and require to go through some kind of approval process with the FDA. And there's some struggle there about what should that process be? Should it be changed from what it has been for other medical devices? But that's a bit of a break in this rush to implement devices. Another speed bump is the question of reimbursement. So there's no specific exactly how to reimburse procedures that are performed with AI tools is kind of up in the air. And so, you know, the Center for Medicare and Medicaid Services that reimburses for Medicaid and Medicare, that is another break, because whether hospitals and physicians are going to get paid for doing certain things will also influence, you know, the speed of the adoption of something. So, in addition to all the points that Dan made, there are some procedural things in the system now that guarantee, or I won't say guarantee, but provide, you know, a certain level of reassurance about safety. But having said that, everyone's grappling with this whole new world and trying to figure out, how do we modify the procedures we've always had in place for regulating and overseeing safety and healthcare to accommodate this new technology in a way that preserves the element of safety, but also allows us to pursue innovation in ways that serves the common good and the interests of the patient.
Right. Well, I'll ask one final question, and that is, do either of you have anything to add that maybe wasn't brought up that you want to share with our listeners?
Well, I guess I would just say I think it's a document. It's a long document. It's the second longest encyclical according to my count. So, you know, our listeners may not be able to read the whole thing, but you know, I would invite you to dip into sections, you know, to kind of browse it. It's an incredibly rich document. There's a lot there that we didn't have a chance to talk about today in an hour-long conversation. But yeah, I think the final takeaway that I have is there is Pope Leo is providing global leadership on this. And it doesn't matter if you're Catholic or not. I mean, he is providing this leadership that any human being can appreciate, that we are not machines, that AI is not a person, and that AI should be used to promote human flourishing. Again, anyone can be behind that. And I think, you know, we ought to be grateful for the Pope's intervention, but we have a lot of work to do. He doesn't say everything that needs to be said, and he certainly doesn't go into the details, whether it's in healthcare or it's in policy, that needs to be unpacked. So that leaves all of us with a lot of work.
Yeah, and I would say that this encyclical is the latest iteration of the Vatican activity on AI that's been happening for 10 to 15 years. You know, about 10 or so years ago, the Holy Father called to Rome people like Microsoft and Cisco and IBM and other public policy people to come up with the Rome Call for AI Ethics. So there's a whole body of work that the Vatican has produced, whether it's articulations like this encyclical by the Holy Father or statements like Antiqua and Nova, which Dan referenced from different dicasteries. So, you know, and many of those have dealt more specifically with healthcare. And I don't think a week goes by that there's not an AI conference of some kind in Rome sponsored by the Vatican. So if people are interested in learning more about what the church is doing on this issue, and specifically what different parts of the church have said about healthcare, they can definitely do some research and find out lots more information. So.
Right. Well, again, thanks to both of you. Again, we've spent time over the last hour with Daniel Daly, Dr. Daniel Daly. He's founding executive director of the Center for Theology and Ethics in Catholic Health. It's great to have you, Dan. And Kathy Curran, she is senior director of public policy at the Catholic Health Association. Again, thanks to both of you, and would encourage those watching, listening, to check out the new issue of Health Progress, which is devoted to this very topic. And you can find that on our website. It's chausa.org. I know that there's been some links put in the comments during this conversation, so check those out. And again, thanks for participating in this Catholic Healthcare and Artificial Intelligence Health Progress AI Week event. Thanks for being with us. Take care.
Thanks.